So good morning, students. So in this, we are going to discuss about formulation of this pulmonary drug delivery system. So in this, there are different types of techniques nowadays came to formulate this pulmonary drug delivery system or nasopulmonary drug delivery system. So in this, we have various types of drugs we are delivering through this, and different types of dry powders we are using, which will be prepared by freeze drying technique or spray drying technique, and different types of lipids and polymers we are using as excipients for this. And with this, so we need to take different types of methods to formulate this type of drug delivery system. So let us discuss about the different techniques there by which we can deliver the drug and make the formulation of this delivery system. So first one, the micelles. So micelles is known as your a technique to deliver different types of drug delivery. It's not only for pulmonary drug delivery we are using, for solubilization, for the coating of different drugs, to prepare nanoparticles. We are also using this micelle formation, and these will change the release properties. Also, these will increase the shelf life and make low toxicity of the drug. And with this, if we try to see different types of nanoparticle dispersions, that size range will be 10 to 400 nanometer diameter, which can be prepared by this micelles formation. And with this type of formation we are telling as nanoparticle dispersions, and the drugs can be trapped inside the core of the micelles, and that we can use for the pulmonary drug delivery system. So generally, what is this micelles and how it is formed? That already you know. Micelles generally, when we are adding surfactants in a solution, these will stay on the surface of the liquid, and when the concentration will be more, when more amount surfactants will add, it will go to the bulk of the solution, and when more amount of surfactants will add, it will stay in the bulk of the solution and start forming micelles. So that point we are telling as your critical micellar concentration, above which the micelles start forming. So when the micelles will form, it will enhance the solubility, it will make a coating on the surface of drug. So different types of advantages we will see. So that's why, and nowadays micelles are used to formulate for the nasopulmonary drug delivery system. Now, coming to the second one, cyclodextrin. Cyclodextrin generally it is a association of oligosaccharides, and it forms a 6, 7, 8 units of glycopyronates. So this glycopyronates, that is we are calling as alpha, beta and gamma cyclodextrin, that will form. And the outside part of this cyclodextrin having hydroxyl group, and generally which are hydrophobic in nature, but inner part of this is lipophilic in nature. So the following which the partial inclusion of the drug will occur, and the drug can be interact with the different bondings like non-covalent bondings with cyclodextrin, and which will increase the solubility of the formulation in the aqueous medium. And with this, beta cyclodextrin is morely used in pharmaceutical development for the formulation, and this is popular due to its sizes, its size of its cavity and its complexation efficiency with the drugs. So different types of drugs like testosterone, salbutamol, and rolipram. So these are generally complex with this by using this cyclodextrin, and the different formulations are made. Then another type of system is lactose carrier system. So this lactose carrier system uh, generally long deposition. The particle size should be within the range of 30 to 100 micrometer. So that's why we are using alpha lactose monohydrate as a bulk carrier, uh, which with this, particularly in the dry powder inhaler, we are using this technique, lactose carrier system, which will enhance the physical forces, surface property, and that's why we are telling us it will behave like a carrier particle for the drugs, and that is lactose carrier system. And next one is large porous particle. Large porous particle generally it's a new aerosol formulation, and that is a large porous hollow particle. That is a trademark. It's coming. It's in a brand name that is known as your Pulmospheres, which is having a low particle density, excellent dispersibility, and it can be used for the both MDIs and DPIs. And with this type of formulation can be made by using a polymer or without a polymer. And different techniques we are using like solvent evaporation, spray drying technique for this to prepare this pulmospheres, which is a large porous particle. And with this, they are particularly made by phosphatidylcholine, and which is a primary component for the human lung surfactant. And with this, also we are using biodegradable polymers like polylactic acid, polyglycolic acid, and the next technique is mucoadhesive drug delivery system that already we have discussed so many times. And this mucoadhesion techniques is suitable for the attachment of drug delivery system in the mucus, and it will increase the interaction between the mucin and different types of synthetic or natural polymers. And nowadays mostly this mucoadhesive is also used in the intranasal drug delivery system, and different types of chitosan, alginate, cellulose derivatives we are using and mucoadhesive material for this. And next technique is liposomes. So liposomes generally we are taking as a vehicle for the pulmonary drug delivery system. That means for delivering the phospholipids in the alveolar surface for the treatment of neonatal respiratory distress diseases syndrome, and different types of gene therapy, and delivering the drug to the alveolar surface of systemic diseases when using this liposomes are a vehicle, and this will enhance the half-life and extent of drug encapsulation. So liposomes may be of small sizes or large sizes. If it is small sizes, it will be less than 0.1 micrometer. If it is large sizes, then it will be more than 0.1 micrometer. And coming to next one, microspheres. So microspheres already we have discussed in the microencapsulation technique. So for that we have different types of agent we are taking, biodegradable polymers we are using for the sustained release pulmonary drug delivery systems like oligolactic acid, and polylactic acid. Also sometimes we are using hydroxypropyl cellulose, which will prolong the pharmacokinetic and pharmacodynamic profile of the different types of crystalline drugs. And coming to next one, nanoparticles. Generally, nanoparticles are the solid colloidal particles, which will be diameter ranging from 1 to 1000 nanometers. And with this, they are particularly used for the different drug carriers, and they are having the active substance. It may be dissolved or entrapped or encapsulated and chemically attached, and they can offer different advantages due to its small sizes, and also it can penetrate the mucosal membrane by the paracellular route. And with these so many advantages we will see, and of these nanoparticles. And with these, nowadays different miscellaneous approaches also we'll see. So these miscellaneous approaches, uh, different types of brand names of new technology came, like AREX, AERX, that is a registered brand name, a pulmonary drug delivery system. And another one is Akita, AKITA, Akita inhalation system. Uh, that is made by a Germany company, Active Hero, and a pre-dose trademark system that is made by a Profile Therapeutics. And with this, different types of brand names come. And with this, nowadays Akita technology have make Akita 2, which is operated by ultrasonic and uh, ultrasonic mass nebulizers. These will nebulize up to 99% of the field content, and with this, uh, they are able to make particle size very less, around less than uh, around 4 micrometers. So that's why new technology nowadays came to deliver the inhalation system correctly. So these are the different formulations. Now coming to applications. So nowadays different applications in so many diseases it's used. The first one is asthma and COPD. COPD means chronic obstructive pulmonary diseases. So particularly this pulmonary route is preferable for the asthma and chronic obstructive pulmonary diseases, as it will give local effect there as well as systemic effect. In diabetes also nowadays it is used, and in angina pectoris it is also used as different types of like nitroglycerin, which is a coronary vasodilator, which is used in angina pectoris, and generally it's coming in the sublingual form, and nowadays it's also coming in the form of pulmonary drug delivery systems, and it can be also used in tuberculosis, and particularly for anti-TB diseases, anti-TB drugs particularly, these are coming in the form of pulmonary drug delivery systems. And with this, in the bone disorder also nowadays this pulmonary drug delivery system used, like osteoporosis, Paget's disease. In these diseases, the bones can be treated by the pulmonary drug delivery system, which will able to uh, decrease the uh, effect of diseases and increase the therapeutic efficiency of the drugs as comparison to other drug delivery systems. With this, also nowadays gene therapy, for the gene therapy also pulmonary route is preferable route, and for that we are taking different types of potential drugs, and for this like your cystic fibrosis, for the treatment of cystic fibrosis we are taking pulmonary route, and with this also for the transplantation we are using this pulmonary inhalation route. For example, aerosolized cyclosporine, and during lung transplantation, uh, for the pulmonary vascular pressure, during interpulmonary shunt, and different types of drugs are used through the pulmonary systems or inhalation systems. So with this we have completed your nasopulmonary drug delivery system. So with this, thank you.